The World Health Assembly is the highest decision-making body in global health. And it is at that level that decisions on policy issues are taken. So it is very important that our member states in the Americas are present and participate in that level of policy decision making, which is bound to have a implication for their own policies. We will discuss issues dealing with the framework for engagement with non-state actors. How is WHO and by extension PAHO, how are we going to ensure that non-state actors have an ability to participate but not to influence the policy decision making? And how will the organization ensure that this can be done in a manner that is beneficial to both? That's going to be important for our member states. It's also the emergency program, for WHO's emergency program, building from the experiences on Ebola, and now with our experiences with Zika, which was a very positive experience. WHO has defined the emergency program for across the organization, for the 6 regions, and for headquarters here. That's important because in the emergency program, we see a unification of the approaches and in terms of the functions. Also, the need to strengthen both regional and country offices so they are better prepared, better able to respond, and to detect and to respond, but also to examine what are some of the resource requirements for that, both in terms of human resources but also financial resources. WHO is saying that this will require close to $500 million, no? and for that budget. So that's going to be very, very important. As you will know, the Americas, we do have a very long history of emergency work and response to outbreaks and humanitarian crisis. And so we've contributed a lot of that experience and a lot of that knowledge to the definition of this emergency program for One WHO. We are running out of antibiotics that are necessary to fight disease, and there are very few antibiotics, if any, in the pipeline. So it means that those that we have now, we have to ensure that our microbes, our bugs do not become resistant to them. So a plan of action is going to be put forward on that. We are also looking at some of the NCD indicators and targets that we needed to respond to, some of the demands that were made by the UN General Assembly decisions. So that's going to be looked at the same time. We will get, there will be a report for the Commission on Childhood Obesity. That is of very, very high importance for the region of the Americas. You will remember that one of our member states has the highest rate of obesity among children in the world, but that also obesity among children is increasing across our region, so that's going to be important. Also, a plan of action on elderly health. That too is very important for the Americas. We are aging very rapidly, and we are aging at a rate that is higher than the rate that the industrialized countries aged at. We will also be looking at some health systems issues, and in particular a global strategy for health workforce. And for the Americas, that is important. We just recently looked at the education of nurses. We looked at the distribution of nurses. We looked at the education, not just of nurses, but also of our doctors. We are producing many specialists. We are not producing sufficient primary healthcare doctors and family doctors. And we've also been looking at the distribution, or I should say the maldistribution of medical doctors. PAHO, the Secretariat, has a very important role to play, and our role begins way before the Assembly itself. So we make an analysis of all of the agenda items and the documents of the agenda items. We examine the linkages with resolutions that have been taken in PAHO, and we have in-depth discussions of those with our PAHO representatives. And our PAHO representatives then in turn have a discussion with the Ministries of Health and the member states. We also examine and take the pulse of what are some of the political issues surrounding each of those agenda items, and we make that information available to our governments and our member states. And in addition, particularly for this agenda, for this World Health Assembly, we had special meetings with all of our ministries of health around some of the more conflicting agenda items. So, and particularly to stress issues of significance and importance for the region and for the regional office in PAHO. The countries of the Americas are member states of WHO, and they attend World Health Assembly, and they participate in formulating policies at that level. And so the policies that they formulate at the World Health Assembly obviously has a bearing and importance for our work at the regional level. Often the strategies are defined at the World Health Assembly, and then we must put the regional specificity to those. And very often then our plans of actions would be responsive to those global strategies, but would ensure that our regional specificities are addressed within our plans of actions. And those plans of actions are then taken to the governing bodies of PAHO. And so our member states have another opportunity to refine those policies for implementation at their level. The countries of the Americas are very active during the World Health Assembly. They work in supporting each other. They work in defining common positions. It is very important at this level of negotiation to have common positions, and they have common positions by sub-regions, sub-regional entities, but also as a region they have positions, and they are very well organized, so they will themselves have meetings in the mornings and sometimes in the evenings to arrive at those common positions. This will require discussions among themselves and an understanding of what are the nuances for each of those countries before they come to a collective position on these issues. So I'm very grateful to the Ministers of Health of this region for their active participation in the World Health Assembly and putting forward the regional perspective. Because it is important that the regional, not just the regional perspective, but what have been some of the successes and the gains of the region, and making this visible at the global stage, and influencing what happens at a global level, because our countries have reached a state of health development that they can contribute best practices, they can contribute significant lessons learned to the global level, and they are not shy in doing this, and I am so grateful for them for that.